Morning, everybody. This is Chandra from Green Tree Chiropractic. For those of you that haven't visited me before, I am located just outside Stoken Church, High Wycombe, in a sleepy little village called Studley Green. So today I'm going to be talking to you about migraine. If you've had migraine in the past, I'm sure you're intimately familiar with exactly how painful these can be, focused usually around one eye, that throbbing headache. And it feels worse with just normal stuff, walking up a flight of stairs, going from room to room. And I think it's hard sometimes for people that don't have migraine to understand exactly how painful this is. But the World Health Organization actually took a look at all conditions that would lead to loss of days work due to disability. And migraine is ranked as the number 19 out of all conditions, so it's pretty high up there. Again, part of the reason why it's so debilitating is that light makes it worse, sound makes it worse. 80% of people get nauseous, 50% of people are going to vomit, so it really does have a big impact on the quality of your life. So the first question you're going to have if you start to experience migraine is, how do I make it, what do I do to prevent these attacks from occurring? Now, chiropractic is really good for migraine prevention. Now, I have to warn you, when you're talking about preventative therapies, unfortunately, none of them have 100% efficacy, meaning you're never going to be completely pain-free. What you're trying to do is reduce the frequency that they occur and how long they last when you have them. And chiropractic has been shown to be really beneficial for this. I think it's probably because it addresses the triggers that we have. So poor posture leads to muscle tension. Muscle tension is a big trigger. If you look at how a joint moves, you've got receptors in a joint which talk to the muscles about how tight to be. A tight muscle pulls onto a joint. So if you've got a joint that's not functioning, it's going to give duck information basically to the muscles, which is going to cause them to tighten up. Again, that's going to maybe lead to the trigger of a migraine to start. So, and it creates that circle as well, which can make them occur sometimes a little bit more often. So by looking at joint function and muscular tension, and chiropractors like I myself do a lot of soft tissue as well as adjustment, hopefully you're trying to reach both of those. Also, I think just by going out and doing something for yourself, taking control, it reduces your anxiety about the condition. Anxiety is a big trigger for migraines. If you feel like you're doing something positive to make this better and you believe it's going to help you, that has a positive effect on reducing triggers as well. And the advantage of chiropractic is that there's no side effects. You know, any kind of time you take medication, it can have side effects, and with chiropractic, you don't get that aspect. Now, if you do think that drugs are necessary, I've got some updates you might want to talk to your GP about. So a lot of people take topiramate, which was originally developed for epileptics, or propranolol, which was a heart medication for hypertension a lot of the time. And both of these are really good drugs at migraine prevention. What they do is they stop the blood vessels in your brain from dilating or expanding out. That pulsatile pain that you get from migraine is really because they expand out and they contract. So that boom, boom feeling that you get is the feeling of the blood vessels themselves. So both of those medications try and stop them from going into that expanded state, as well as maybe blocking some of the inflammatory chemicals or some of the pain-releasing substances. Now, there's a really new drug that's very exciting for migraineurs that's just come out. It's called Arenumab. This has just been approved in the US, I think it was August last year. It's an injection that you would give yourself monthly, and they're finding some really good results. It's very new, but they're finding that it could relieve maybe up to 50% of migraine attacks, stop them before they start. It's not on the NHS yet because it's so new. The NHS is still looking at how effective it is versus how much it costs. But if you look at the UK's National Migraine Society, and again, in conjunction with your GP, the National Migraine Society has got doctors, and you can sometimes get this on a private prescription. So it'd be worth maybe talking to your GP about as well. Now, when you get migraine, what do? Well, you want to crawl into a dark hole and hide away from the world, don't you? A lot of people also take over-the-counter drugs. So you might be thinking about taking ibuprofen or Nurofen or aspirin or naproxen. All these are a category of drugs called non-steroidal anti-inflammatories. They're very good at relieving the pain once it actually comes on. One word of warning though, I treat a lot of people for migraine prevention. And what I see sometimes is that my patients don't realize that something like Nurofen and ibuprofen are essentially the same thing because they've got different names. And so they're double dosing themselves. If you take too much of your NSAIDs, it can lead to ulceration in the stomach. So you need to be careful. Same thing, paracetamol is another good drug for pain relief. But if you overdose on that one, you can damage your liver. So please make sure that you're following medical advice, taking these as prescribed, and make sure that these aren't the same medication that you're taking repeatedly. Other things that you can do to help yourself, particularly if you're new to migraine, because they tend to start maybe when you're in your teens or your early 20s, or sometimes people actually get them later in life. Keep a pain diary because your triggers vary enormously from person to person. So there are the kind of more well-known ones like alcohol, caffeine, chocolate. I know it's all the good things in the world. But people might not be aware of things like citrus fruits, cheddar, Stilton, camembert, smoked foods, pickled foods. All of these can lead to migraine trigger. Other things like not drinking enough water, dehydration is a big trigger. A massive one is sleep. If you're tired or your sleep quality is poor, that can be a big trigger. So you want to look at your sleep hygiene. Don't watch TV an hour before you go to bed. Maybe consider doing some relaxation exercises or something like that, because that will also, again, maybe look at the anxiety levels and help to reduce them down. Eat regular meals. This is a big piece of advice because you don't want that dip in blood sugar to come in. You don't want to get hypoglycemia because that can trigger them as well. Other things like menstruation, all those. Again, it just helps you to know what the triggers are so you can try and reduce them to, again, prevent those attacks. I said I would talk a little bit about the goings on in the brain for the nerds out there like myself who like the science. So they used to think that migraine was purely that expansion and contraction of the blood vessels, but now they think it's actually also due to the way the nerves communicate in the brain. So if you take a migraineur who is not experiencing headache and you put them into a functional MRI, at baseline, they're going to have more chit-chat, basically, between the nerves than somebody who doesn't experience migraine. And this is called being a little hyperexcitable. And basically what that means is that they're a little bit more vulnerable to chemical changes in the brain that cause that chatter to increase. And what happens, so we think about something like aura, when you start to get that increase in chatter in the brain, you get something called cortical depression. And this is basically this widespread wave of activity going through the brain. And a lot of times it actually goes to the back of your head. This is your occiput, and this is your visual center. And so the most common type of aura people get is flashing lights or zigzagging lights, and it's because they're activating chatter in that part of the brain. But because migraine can activate all sorts of areas of the brain, you can actually get loads of different types of migraine coming in. You can get things like the room is spinning around you, vertigo. You might not have any headache with them. You can get some really scary symptoms. You can get symptoms that make you slur speech or paralysis of a limb. You can also get some that you become uncoordinated for a period of time, and those can come off like excuse me, like stroke. So if you experience this for the very first time, you definitely need to go see a GP just to make sure it is migraine and not something worse. You always need to seek medical advice for something like that. But it can also be something, sensory changes. So some people get pins and needles coming from the hand, moving its way up the arm into the face and the mouth, all sorts of different things. So it's always good to get these checked out. Sometimes diagnosis can take a little while if you've got one of the less common variants, but it's definitely worthwhile getting it checked out and getting a medical professional on that one. So again, to summarize, if you've got migraine, please give me a call, or if you know somebody that's suffering, because there are things that you can do. Chiropractic is very beneficial in prevention of migraine. We've talked about some new drug updates you might want to talk to your GP about. Again, when you get the attacks, you want to think about lying down, being quiet, breathing exercises maybe. And again, if you're taking those over-the-counter drugs, make sure that you're staying within medical prescription. Also, NHS recommends take the drugs when the attack starts, not when you've actually got the pain. And maybe try a water-soluble variant because that might make it easier for your body to absorb. Avoid those triggers. and keep track of them so you can make the most of trying to identify and again stopping that process before it starts. I hope you found this beneficial. If you have, please like my page. I'm really trying to do a big push for education to help you guys be more able to help yourselves. If you've got any questions, please feel free to comment below or send me a private message and I'll do my best to help you. And again, if you or anyone you know is suffering from migraine, please give me a call. Definitely chiropractic is very good for prevention and I'd love to be able to help. Hope you guys enjoyed this and have a lovely day. Thanks so much.